Sandeep Sharma sir is a very eminent faculty and a very respected pediatrician all around the country. And today we have him here for introducing us to his branch through his point of view. And I'm Yatika Pasricha. I'll be going through with this interview. And so let's get started.
Thank you for inviting me here. And Dr. Yatika has already given my intro. I'm Dr. Sandeep. I am a pediatrician. I'm working currently at Chandigarh. I'm a practicing pediatrician. I did my MD pediatrics from PGI Chandigarh, and it's been almost 10 years since I completed my MD. I'm also, training students for various competitive exams. But at my heart, I continue to be a practicing pediatrician. So lovely to be here. It's all my pleasure.
Sir, can you just give us a brief intro about how pediatrics is after we complete our MD? So, like we know that there are basically two types of setups that we can go into. One is a government setup and one is a private setup. So, what kind of a life can a person expect after they pursue MD pediatrics?
If you do your post-graduation in pediatrics, whether it is MD or DNB, after that you have multiple options which are available to you. First option after you finish your post-graduation is you can go into senior residency. Senior residency seats are available in various medical colleges. Maximum tenure of a senior resident is up to 3 years. It is always advisable to do SRship for 3 years because if you tomorrow want to be a consultant, you want to join as an AP in a medical college, and it is a central institute. Most of the central institutes, they require 3 years of post-MD SRship. There are certain government places and even private places where even 1 year or 2 year SRship is good enough. So that is a personal call, whether to go for 3 years, go for 2 years or so. But this is one area you can continue with SRship. SRship is available in your home medical college. It is also available in various allied medical places which are not truly medical college but are working government hospitals. It is also available in the central institute. So tomorrow you want to do your SRship from AIMS. That is one possibility, right? There is an exam for that. Second possibility is a lot of people, they try to go into government service. So you can sit for the state service exams, you can sit for the UPSC, CMS exams, and then you can also sit for, there are ad hoc posts which are available. Periodically, there are various types of, government posts which get advertised. Every state has their own way of calling the people. There are ad hocs as well as regular jobs. You can apply for them. And they are quite easily available because pediatrics, India still has a very high infant mortality rate, and the number of empty seats all over the country is very big. Third option that you have is you can move into corporate setup. A lot of people move into corporate setup. That is what I did also. I did my SRship, but immediately afterwards I moved into corporate world. So
if and when we decide to become the professor, like that experience counts. If you go into the corporate, that experience won't count then.
Yes, Yatika, you need to be clear in this. See, in my mind, I was very clear. The day I entered into pediatrics, I was clear I am not going to go into government service. There were multiple reasons for that. So that was my take. And so I decided that I need to have some SRship experience. I did it for 1.5 years in a medical college. After that, I went directly into practice, corporate along with practice. I did not do the 3-year thing because I was clear in my mind. But somebody who's not clear or somebody who has a possibility that they may be joining, I think it would be advisable that they join a senior residency. Being clear is always better. A lot of clarity comes once you join, and first couple of months also you talk to people, then clarity comes. But it is always better to be clear during your PG rather than to decide after finishing your PG what direction am I supposed to go.
That way, because neither are we we tend to lose time, and even in the corporate thing, there is, if you would have joined earlier, you would have settled in that city for 1 year, and whereas you were doing your SRship in some other city and now you've decided that you're already 1 year late then.
It's a very valid point. See, it's not only about pediatrics, it's about most specialties. I often find students that are very bright. They take up a branch, but they don't have an idea what they want to do with that branch. See, I take up a branch. I should be clear in my mind 3 years from now, 5 years from now, where do I see myself? And your goals should be directed according to that. Some of my juniors, I would say, what happened with them was MD हुआ, उसके बाद fellowship join कर लिया, उसके बाद डीएम का तैयारी कर रहे हैं, then they decided वे फैमिली प्रॉब्लम्स आ रहे हैं, जॉब करना चाहिए, so they wasted a lot of time. See, none of us is immortal. कल को देखो फैमिली भी बनाना है, पैसा भी कमाना है और अपनी लोगों को ट्रीट भी करना है. So you need time for that, and the sooner you get into the definite place you want to be, the better it is always.
But also, why did you start to like this branch? I'm sure you must have been getting a lot of clinical branches. Then why settle on pediatrics?
I was getting almost all clinical branches. I was ranked 14 in my time in PGI, so I was getting almost every branch, and the number of seats was also good at that time. So what I decided was I did not want to be a surgeon, so surgery was ruled out. Surgical branches were ruled out. I was not. I wasn't happy doing surgical stuff. Secondly, I did not want to go into. I wanted patient interaction, so radiology in a way was out for me, because radiology, whatever you say, there is very minimal patient interaction, and that leaves me with only 3 or 4 branches. Among them, I realized that if I take up medicine, medicine is a wonderful branch. The problem with medicine is it takes a lot of time. Reason being simple, you have a bigger patient base, but you also need to do DM. You may say that yes, a particular X person is very successful. You are seeing him today. He was a medicine resident 10 years back. You have to see from today's perspective what is the situation going to be 10 years later. And 10 years later, only MD pediatrics or only MD medicine is not going to be sufficient. In pediatrics, still there is a role that being a pediatrician in a smaller town, you can do a simple practice. But pure MD medicine, you have to do DM at one level. So that is one thing which made me clear that I want to move. Plus, I like kids.
Okay. I think medicine is just glorified MBBS. Whatever we study in MBBS, in depth, we have to study in medicine. I would not like to say that, but that's the truth of it.
Yes, see, if I say it, I have a lot of friends and colleagues in medicine who would be like, "Why are you saying like that?" See, but yeah, partly it is true. Whatever you are saying, it is partly true. That being MD medicine alone, again, individual caliber will vary from person to person. But if you move into the market, suppose you try to do practice in Chandigarh or in Delhi or Mumbai or Bengaluru or Hyderabad, it is going to be very tough. It will take you almost 10 years to find a good running practice where you are able to, be comfortable in your financial position. Doing DM in medicine is now like almost a sure thing. You're not able to do it, you're not able to get into it, or you decide later on not to do it. That is a separate issue. But once you're moving into medicine, I think it should be clear in your mind that if I want to settle in a bigger city, I have to do DM. If you are willing to work in a smaller town also, or willing to wait, or you have a system already running, you have a small setup already made, then obviously pure MD should be fine in that.
Sir, I have my co-interns, they are planning for we will do MD medicine and then we will do medical oncology. And they are planning, the people who love medicine are already planning for their DMs right from their internship. So I guess that says a lot about when you want to settle in a metro city, that says the importance of doing DM in medicine.
See, as people are becoming more and more aware, I think it's a good thing that there is clarity in their mind that they are supposed to, and because they know they have a passion for medicine as a branch. Secondly, they are clear in their mind that they are going to be oncologists, so they are going to plan and they are not going to panic. So they know that first they have to crack the entrance exam, get into MD medicine. MD medicine people are the brightest people because they are mostly top rankers, and also they are the ones who read the maximum. I have tremendous respect for medicine residents because सबसे ज्यादा दुखी वो लोग होते हैं. मेरे friends से सबसे ज्यादा काम वो करते हैं. With all due respect to orthopedicians, pediatricians, etc., सबसे ज्यादा जो hard work करने वाले दुखी आत्मा है, those are medicine people. करते हैं. But उसके बाद भी they know that they are going to sit in a very competitive exam known as NEET SS or INISS, and then they are going to sit for very small number of seats. And so they plan their studies accordingly. So that is why what you said earlier, you should have clarity in your mind. कुछ लोगों को clarity नहीं आता है, but at least be clear कि मुझे क्या नहीं करना है. So rule out those options in your life. ये नहीं करना. So that you are clear, you have some limited choices from where you have to make that call.
Like, why did you choose pediatrics particularly?
See, in my case, I was clear that I will not be taking surgical branches. I wanted a relative terminal branch. At the same time, If situation arose that I have to go for super specialization, there should be scope for that.
Hmm.
At the same time, I liked kids, and I wanted to take a patient-oriented, practice-oriented branch. So, if I look at which is the branch which was ticking all the boxes for me, it was pediatrics. It was you can do MD pediatrics. I'm MD pediatrics. I'm not a super specialist, but I'm working and I'm doing okay in my practice. Tomorrow, I want to do super specialization. I still have a few years left. I can always decide. I can prepare. Right now I coach students, but tomorrow if I decide, I can still prepare, sit in the super specialty exam, not only in the pediatric super specialties, but also MD pediatrics is eligible for the adult super specialties also. Not totally, but in certain institutions. Earlier it was totally, abhi change ho gaya. So that flexibility plus I like kids and बच्चे हमेशा पैदा होंगे इंडिया में. India is now the most populous country, so you
Yeah.
will always have patients available if you are good.
It was very nice knowing about all of these things, but what are the not so nice things about pediatrics?
Not so nice things. Number one, there is a it's a hectic branch. It's a very hectic branch. तो अगर आप सोच रहे हो कि आप रेजिडेंसी में एंजॉय करोगे, नहीं होगा. You have to take out time, but mostly नहीं होगा. It's one of the very hectic branches. So most hectic branches में I would say institution से vary करते हैं, but medicine, pediatrics, orthopedics, general surgery, these are the I would and OBG to a certain extent 4 or 5 most hectic branches. Right. दूसरा चीज there is a learning curve. You come out of MD pediatrics, it is very difficult for you to start your own OPD or start practicing. You
Okay.
don't have that confidence. You don't remember exactly the drugs. And what happens is when you are working in a medical college, you are seeing a lot of complicated cases. So complicated case management, but in private practice, complicated cases are not going to come to you. You are simply going to do basic first aid and you are going to refer to them. It is the common cases like URI, UTI, mother simply saying my child is not eating well, parents bringing their 15-day child, crying episodes, no cause can be found. Now, these kind of things, there is a very limited exposure in our medical colleges, most medical colleges. And so you need to, and patient will not be telling you. So you need to have that learning curve, that ability to make the diagnosis and treat the patient. Plus, third thing, you need to be good in your patients and counseling skills. Patients and counseling skills, because the child will be the patient, but there will be mother, father, grandfather, grandmother, their relatives, random people coming to you. You have to convince them. You have to not lose your patience and focus on treating the patient. So I think that patience and counseling skills are important. And fourthly, if you're thinking you'll come out of MD pediatrics and somebody is ready with a 1 crore per year offer for you, not going to happen. Not going to happen in any branch. Certainly not happening in pediatrics. It's a slow earning branch. It's not a procedure oriented branch. पैसा आएगा. No pediatrician I have ever met in life doesn't do well. ऐसा नहीं है, सब के सब अच्छा कर रहे हैं. But at the same time, you need to be patient. So patience with patience with earnings, and patience with learning the skills. So और ये अगर नहीं है आपके पास, आपको चाहिए फैंसी लाइफस्टाइल, आपको चाहिए नाइट ड्यूटी नहीं करना है, फिर दिक्कत होगा. ये ब्रांचेस का प्रॉब्लम है. And another small thing is MD pediatrics alone is not sufficient if you want to settle in the 4 metro towns of country. It is not sufficient. आप कुछ भी बोलो, कोई कुछ भी बोले, आई एम सेइंग विद 100% कन्विक्शन, नहीं सफिशिएंट है. अगर आपको सेटल होना है, you will have to either move out of the bigger towns, go to the periphery, or you will have to do fellowship or super specialization. So that point has to be kept in mind.
So I really appreciate you making it very clear. And going on to the next question, like what is the scope of growth in pediatrics? Like you have made it very clear that there is a certain lot of growth in metro towns. Certainly that is there. But what are other opportunities that MD pediatrics or someone who's considering pediatrics should keep in mind?
After doing MD pediatrics, as I said, one is the job opportunities you can do. Secondly, apart from that, you can always decide of moving into armed forces. You can always decide about moving into various research organizations.
I'd like to. I would like if you elaborate on how will you move into armed forces, because I think for that you have to take a completely different pathway. Since MBBS only you have to be in AFMC, I guess.
See,
So yes.
there are three ways. Three ways. One is the way in which you take up AFMC, you join AFMC, and then you go into a bond, and then you are a part of the government setup. Second way is, as some of my colleagues did, they did their MBBS, then they joined government service. They joined one of my very close MBBS friend. He joined armed forces, went into army. Initially went for short service commission, then got the opportunity to sit for a longer commission. He got a permanent commission. Then under the army quota itself, he did his specialization. Right now, some months back, he was posted in Africa, and he has just been back to India. So right now, like, he's working in a military hospital as a specialist, and he said that once that minimum time gap will be over, then I will be coming out and, joining a corporate hospital. So he's right now in a dilemma: should I go for super specialization, or should I super specialization? Also, those who are in army service or air force service, if you are a part of the permanent commission, आप उनके ही कोटा से कर सकते हो in the central institutes. So that is one good thing that is available. But again, is lateral entry भी possible है. Lot of people after doing MD/MS, there are posts which come out. They are publicized. You need to watch out for them. You can apply, and you can take a lateral entry for that also. Usually these are short service commission posts.
So also, can you like describe the lifestyle of an army person? Because I think that has a lot of glamour and glitz associated. So I think there should be proper knowledge, and somebody who is credible, they should hear it from them, I think.
See, I'm not the right person to comment upon how actually the lifestyle is. What I can say here is what I have heard from, as I said, some of my close friends. Number one, you need to keep that fear out of your, just take out that fear out of your mind. Okay, you're moving into an army, so you know it is going to be war. No army doctor goes into the battlefield, and they are not going to fight anywhere. So they do get postings at difficult places also, but the army, air force, navy, they take very good care of their doctors. So you will be at the most secure place, even in a very risky cantonment if you are placed. So you will be the most secure person. Number one. Number two, there will be certain restrictions which will obviously come into play. So you will have certain restrictions related to travel outside India. You cannot simply pack your bags and leave. You have to go through the proper channel, take permissions, and go alongside. Then you have to, when you want to move out of the army, there is a proper procedure for that. You cannot simply decide through a resignation letter and move out of it. Then there is certain protocol that is to be followed, like certain days you have to be available. Certain I would say, सुबह सब लोग नहीं उठते हैं, but certain timings have to be adhered to. So a sense of responsibility has to come. At the same time, I think my friend, when I met him after many years, I could not even recognize him. Uska personality change ho gaya. You can actually make out an army man, a serving army man from a civilian.
Civilian.
You may accept it, you may not accept it, but वो जैसा आदमी था और आज वो जैसा है, उसका बात करने का ढंग चेंज हो चुका है. हम लोग उसका मजाक उड़ाते थे, frankly. Right now, if he wants, he can make a fun of us people. But end of the day, I think वो आपको ना वो बना देता है. And it is not only for men also, it is very good for females also. But again, it's a very personal call. And it also depends upon whether you will be taken or not. In case you have any medical issue, any surgery has been done, a lot of other things, stature related things, etc., then you may not be eligible for the army jobs also. Like, you have to be physically fit as well.
Yeah, and going on to the next question, I would like to ask, what kind of people should not think of taking pediatrics? Like, specifically somebody who is in it for just the salary, or except for those people who should like stay away from pediatrics.
Don't like kids, stay away from pediatrics. You have to love kids, right? Mostly there will be hardly any person in this world who doesn't like kids. But if you don't like kids, you are a borderline psychopath. Don't take up pediatrics, right? You are going to be surrounded with kids, crying kids, so you need to have that compassion for the kids. Number one. Number two, if you want to be a millionaire in the next 3 or 4 years, don't take up pediatrics. You can become a millionaire, but the money will not come from the branch. You have to look for avenues outside. You have to be an entrepreneur. For that matter, I would say most medical branches, at least in India, unfortunately they are not as well paying as many of the non-medicine branches are. So that is why if you are running only,
can you elaborate on this point?
Then you shouldn't be taking up. And thirdly, if you're not willing to put in night duties, 12 hours, 24 hours, 36 hours duties, and you want your 8 hours of beauty sleep every day, pediatrics se dur
Not
rehna,
for that.
because you will have to work hard.
Some of the non-clinical branches are not as well. Non-clinical branches are more
I'll
well
elaborate.
than
I'll
the
elaborate. I'll elaborate. What basically the point I was trying to make was, if you want to make money, you shouldn't be doing any medicine branch. You shouldn't be a doctor. Being a doctor, yes, money is important, and I truly believe people who say कि money नहीं है, doctors को एक saintly जिंदगी जीनी चाहिए, they are, it's all rubbish, right? What's important is, yes, you have become a doctor, you will get paid. No doctor is not doing comfortable, but you need to be patient for that. If you want to make quick money, if you want to make a lot of money, then you will have to be an entrepreneur and have something on the side. We always call it as legal side hustles. You can always, there are people who invest in multiple avenues. There are people who go into real estate or stock market. There are people who go into coaching businesses. So a lot of avenues are there. But as a branch, I think money should not be your only consideration. If you are taking money as the consideration, the problem is going to be, you are going to be frustrated after working hard for 3 or 4 years. You are going to say, I am working 18 hours in a day. One of my friend who only did a simple MBA from a private college is earning double my amount. You also need to understand that his job is fine, but end of the day, you are treating somebody's disease. So you are also doing a service to the society. Society may not accept it, that's a separate thing. But you need to have that internal satisfaction. Secondly, you have a stature in society, which that person may or may not have. Thirdly, your income will always be on the rising trend. It will never be static. It will always, whether you're in government, corporate, private, it will always be on the rising trend. You see the layoffs which are happening in the tech sector, ed tech sector, and various things. Layoffs are not going to happen in
medicine,
at least for the next 25-30 years. आपके बच्चों के टाइम में होगा तो कह नहीं सकते. It is not going to happen. So it is a stable branch. So stability, stature is provided. So money is not everything. Money is important, but money is again not everything. As for the non-clinical branches, I would say there are a lot of non-clinical branches also where there are very good avenues. I would say pharmacology is one branch. Pharmacology, with the drug sector opening up and a lot of R&D also happening, I think pharmacology, somebody is not willing to do a night duty and somebody is okay with a non-patient interaction, they can consider taking up MD pharmacology. Again, I'm not the right person for that, but I know a few MD pharmacology people who are doing excellent. I'm not talking about coaching business, I'm talking about their branch business. So they're doing excellent in their life. And similarly, you have other avenues available. So end of the day, even if you take up MS Anatomy, you should like your branch. Once you like your branch, you will find ways to earn money.
Sir, any other special points that you'd like to add?
See, special points I would like to add. As I said, I'll just try to summarize in case something is amiss. Number one, pediatrics, if you want to take a branch, so those who are in MBBS or those who are interns and post interns, number one thing to take pediatrics is getting a good rank. Rank nahi hai to sab baatein hawa mein hai, right? Get a good rank so that you can take a good institute by your choice. If you want to join an institution, you get a good rank. Which place to join? It will depend upon 3 or 4 factors. Number one, it will depend upon कि institute में academics कैसा है. So academics are important. Whether proper seminars and proper grand rounds and all those general clubs are conducted or not. Number one. Number two, you will look at the patient inflow. A lot of medical colleges are in such peripheral places. You will be very free during the 3 years of MD, but it is not a good thing to be too free because you have not seen the patient and now you are going to face a lot of patients. So your transition is going to be troublesome. So see as many patients as you want. So good patient load always works. Third, language. India is now a complete, there are no barriers in the country, but at the same time, if you are getting a choice, if you don't have a choice, it is fine. But if you are getting a choice, take a seat closer to your native place. The simple reason you will have to tomorrow take history, examination, and a lot of other things. And in case you are not comfortable with the language, that is going to cause problem. In case you have taken, like I did from PGI. In my batch, there were 4 people who knew Hindi. 10 people did not know Hindi initially. All of them learned Hindi at that time because to converse. Similarly, if you're going to Jipmer, there is no harm in learning Tamil. Basic working knowledge of any place where you are working. I think we should keep our prejudice on the side. Whatever medical college you join, and if that place does not have your native language, spend 2-3 months. Once you learn that native language, life will be much more easier for you. So that consideration that has to be taken into account. And fourth thing is toxicity in the department. There are a lot of medical colleges, like there are a couple of medical colleges, I will not take names because I have my colleagues and friends and juniors and seniors over there. There are 2 medical colleges in Delhi. They are very good for pediatrics, but end of the day, their academics are great, but the people over there, they torture you a lot. So if you are a very sensitive personality, try to avoid those places. There are some places, PGH Chandigarh, nobody tortures you, but you should have that willingness to put in 36 hours in a day. So are you willing to put that? So that is a call that you have to take. And once you join, be clear in your mind what you want to do. Even after you join, you decide, then also it is okay, but it should not be decided after you have finished your MD or MS. So once you take up, be clear, you want to move into government sector, private sector, or you want to move into medical college and become a consultant, or you want to move into super specialization.
If somebody is clear that they want to prepare for the super specialization exam, should they start itself at the end of the first year, or something like a vague timeline that this should be? Because again, like,
it's a very catchy question. I'm old school in this. I personally believe that if I have joined MD Pediatrics or DNB Pediatrics, my first aim should be to know my branch. There is very little exposure to actual child management during your internship. You hardly get to do anything independently. So first, try to learn the basics. Learn about fluid resuscitation, drug dose management, how to handle a kid, how to hold a kid. Holding a kid is an art. So putting a cannula in the kid, putting an endotracheal tube in the kid, putting a LMA in the kid, central line, learn all these things. Along with this, whatever you are seeing, start reading the standard book, that is Nelson. And in case you are very passionate about it, when you get night off or when you have a prolonged day and then a holiday comes somewhere in between, then try to see what are the exams. If you are targeting super specialty, start seeing from those. I took interviews of some super specialty toppers very recently, 4-5 months back. So they also said the same thing. Sir, a lot of questions asked in super specialty are based upon what we see on a daily basis. So your first priority is to learn the MD or DNB, the skills in the branch, attend your branches. In between, try to sneak out. If you can't sneak out time, take the help of seniors and take the help of people who have done good in your medical college. You can always ask me. I'm always around. I'm always willing to give any advice to future pediatric residents. But your first priority should be your MD skills. Your MD, the branch should be the first priority. Side by side, second year onwards, you can move into targeting and preparing for specialty exams also.
Okay, thank you, sir. And any more points that you'd want to stress upon ending this session?
Yes, what I would like to end this session is by giving a couple of queries which I often get. Number one, a lot of people ask, sir, what about, just a minute. So people ask, sir, I'm not sure about whether I should be taking pediatrics or I should be taking medicine or I should be taking some other branch. I would say, see yourself, visualize yourself, where you see yourself 5 years, 10 years from now, and try to visualize whether you're happy doing that thing or not. Secondly, try to see how the system is going to be at that time. So pediatrics में I can say कि बच्चे हमेशा पैदा होंगे और इंडिया सबसे पॉपुलस कंट्री ऑलरेडी है और रहने वाला है. Our growth rate is going to fall, but still the baseline is so strong that it is going to be, you're not going to be short of patients, but your skills are going to be important. And third thing, whatever you decide, end of the day, you should be clear. Taking a branch is like getting married. It's like arranged marriage. आप लोगों से मिलते हैं, है ना, बहुत लोगों से को डेट भी करते हैं. किसी के अंदर कुछ अच्छा है, किसी के अंदर कुछ अच्छा है. कोई आपको रिजेक्ट करता है, किसी को आप रिजेक्ट करते हो. कोई परफेक्ट पर्सन नहीं होता. उसी तरह परफेक्ट ब्रांच नहीं होती. But once you choose a branch or a person, You stick to it and make it work. You don't look back and say कि काश वो ले लेता या उससे शादी कर लेता. Pick a branch, work hard in it, you will develop passion for it, and if you are good in your branch, money will not be a problem for you at all. I'm telling you, it will not be a problem. Love your branch and take with confidence. I think that is the message I want to give.
I say that go after excellence, don't go after money. If you
Yes,
go after excellence, money will follow.
Money does follow. Yes, money does follow, but ऐसा नहीं कि आप excellent और कमरे में बैठे हो. You need to, then
Be
be practical, and apply those skills. Once you have the skills, you apply them, then it comes to you.
Sir, really great interacting with you and knowing your point of view. It was a pleasure to all of us. And now I'd like to end this session. Thank you very much, sir. We appreciate your presence very highly. And
thank you, Yatika. Thank you so much.
Thank you, sir.
All the best.
Thank you, sir.